As we mentioned earlier, rapid antigen testing is set to be stepped up around the nation. The medical regulator to approve home tests in the coming weeks. That test can be used at home and returns a result in minutes. Let's get some analysis on this. Someone who's been advocating for it in Australia, Assistant Professor at Economics at George Washington University, Stephen Hamilton. Thanks so much for your time, Stephen, as always. Why have we been so slow off the mark when it comes to this rapid antigen testing, given some of the technology's been developed here?
That's right. It's a really sad story, Kieran. So there's a number of different options, but probably the leading provider is a company called Ellume based in Brisbane, and they invented this rapid test a year ago, right? It went through clinical trials a year ago. And still to this day, that product isn't available in Australia. And the reason for that is while the TGA has approved a selection of rapid tests for use, it requires all tests to be carried out by a trained physician or under the supervision of a trained physician, which kind of defeats the purpose relative to a sort of PCR test that we know.
Yeah. But the US Food and Drug Administration authorised the use of this technology 8 months ago.
Yeah, in December 2020. So, you could have been anywhere in the US in the past 8 months, walked into your local chemist and picked up one of these tests off the shelf for $30. And within 15 minutes, you would have known whether you were positive for COVID. And it's really important to note that these tests, one of the biggest criticisms has been their accuracy. But the clinical trial for these tests shows that their accuracy is actually really close to the PCR tests. So something like 95% as accurate, right? So we're not talking a huge difference. And that 95% accuracy number accounts for user error, right? So that clinical trial included people doing the test themselves with only the instructions on the box. So there is nothing to fear of these in-home tests.
And how widely can these be used? How do you see them in terms of the purpose here? Obviously, people before work, conferences or whatever else. How do you see it operating?
The biggest problem we have today, among many, is that we don't know who's infected. Right? That is the fundamental problem. And frankly, it's been the fundamental problem all the way back to March 2020. Right? There are people walking around in Melbourne and Sydney today who have COVID and don't know it. Right? So essential workers that have to go out and people who work in grocery stores or, whoever, right? People who ultimately we can't lock everyone down, right? Everyone employed down. So they don't know that they have COVID. Now, if they had a test, and even if they tested every day, right, we would at least know if they were infected and we could reduce the time that they're out in the community spreading the virus. And so that's why the tests can be really a crucial tool in bringing the number of cases and infections down, right, in isolating people more quickly. Now, yes, the PCR tests are a little bit more accurate, but they're a hell of a lot more difficult, right, that we have to wait days to get a result, and they require people to go out of the house and go down to the testing centre. So these PCR tests are connected to an app. That app can communicate the result to the health authorities, right? So there's really little drawback relative to the current regime.
And finally, before you go, I know you've also been critical of the regulators here when it comes to the vaccine, the management of the vaccine. Today we see some of this Freedom of Information letter and documents released by the Labor Party to various media outlets showing that the offer for a meeting with senior Pfizer executives was made to the Health Minister halfway through last year.
Yeah, look, I would say, Kieran, it's not a surprise, but it is shocking, I think. So there is no doubt, and there has been no doubt, that the deal for the Pfizer vaccine that the government inked in November absolutely could have been inked in mid-2020. I have no doubt about it, right? If the government of Australia had picked up the phone and showed some urgency like the Israeli Prime Minister Ben Netanyahu did, we could have got enough doses to cover our population, right? Instead, we ordered in November, many months late, only enough doses to cover 1 in every 5 Australians, right? And we only figured out that that was a problem in the early part of 2021 when it was far too late, right? So if we had ordered those doses when we absolutely could have in mid-2020, and these meetings seem to confirm that, there's an inescapable conclusion that we would really have avoided so many of the problems that we currently now experience.
Professor Stephen Hamilton from the George Washington University, thanks for your insights as always.